we come to our discussion on two important aspects related to blood pressure, pulse pressure and mean arterial pressure. In this video, we are going to explore their definitions, normal values, and significance for health. During a cardiac cycle, the heart contracts and relaxes. While the heart contracts, it creates a pressure in the circulation known as systolic pressure. While the heart relaxing, the pressure in the circulation decreases to a value known as diastolic pressure. The difference between systolic and diastolic pressure is known as pulse pressure. Pulse pressure reflects the force of cardiac muscle contraction, and also it indicates how well is the elasticity of the arterial wall. Normally, the difference between systolic and diastolic pressure ranges from 30 to 50 millimeter mercury, with an average value of 40 millimeter mercury. Conditions like atherosclerosis or stiffness in the arterial wall causes pulse pressure to increase to a value which exceeds 60 millimeter mercury. The stiffness increases pulse pressure because stiff vessels are unable to expand during systole, and that causes the systolic pressure to increase too much and make the vessels unable to recoil during diastole, and that causes the diastolic pressure to decrease. That will increase the gap between systolic and diastolic pressure, increasing pulse pressure. As for the mean arterial pressure refers to the average pressure throughout the cardiac cycle. This mean arterial pressure is calculated based on that formula: mean arterial pressure equal diastolic pressure plus 1/3 pulse pressure. Mean arterial pressure is very important parameter to be monitored, as this pressure is the driving force for the blood flow. Hence, it indicates how well is the perfusion to different tissues and organs. Normal value for mean arterial pressure ranges from 70 to 110 millimeter mercury, and a decrease of mean arterial blood pressure to a level less than 60 millimeter mercury indicates decrease in tissue perfusion and decrease in oxygen delivery to tissues. In conclusion, pulse pressure reflects how well is the contraction of the heart, as well as how well is the elasticity of the arterial wall. Mean arterial pressure reflects how good is the perfusion to different tissues and organs.